Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And we have a discussion going on here about something that you've been writing to us about. You know, a lot of people are very concerned about obesity and issues relative to obesity, but there is a specialty called bariatric surgical procedures, and we have one of Florida's, shall we say, stars, and Dr. Vincent Maciel, who is sitting right in front of me, and he's from the bariatric program, the Surgical Institution of Plantation General Hospital, right here in Broward County. Doctor, welcome.
Sir, thank you. My name is Victor Maciel. I'm a general surgeon who specializes also in minimally invasive surgery and bariatric surgery as well. So thank you for having me.
Well, thank you for being here. And a very special person, Heather Friedman, who was a patient, a bariatric patient, but really to me is very important because you're the HCA area practice manager, and of course I think if I look very closely through that door, we're beginning to see the building of a very large HCA hospital, which will be on this campus at Nova Southeastern University. So we're glad to have you. Heather Friedman, welcome.
Hi, thank you, Dr. Lippman. Pleasure to be here.
Tell us what you do as the practice manager of HCA.
So for HCA, as the area practice manager, we oversee the physician services group service line,
Right.
which is the medical offices adjacent to the hospitals and facilities of HCA.
So you'll be spending a lot of time in the medical office building, otherwise known as MOB,
Yeah.
right next to the hospital, correct?
I run from MOB to MOB.
Well, we'll see you on the walkway. How about that?
Sounds good.
Dr. Maciel, I know that you, like I said, you do a lot of what we call minimally invasive surgical techniques, and we have been having a lot of discussion about minimally invasive surgical techniques, whether it be in the bariatrics world or the cardiac world and the orthopedic world, neurology, you know, every surgical technique, because these folks out here, over the years, and we just finished our 500th show, so you guess you know we've been at this nearly 20 years. But the top issues with them is really, if I tick 3 or 4 of the top issues, it's always heart disease, cancer, surgical, pain, all right? And then comes the issue of, tell us about minimally invasive techniques.
Thank you. Well, as you said, surgery in general is an invasive area of medicine, and surgery has been practiced for millennia. But in recent years, decades, we discovered a better way to do surgery, to perform the same complex procedures with a better recovery. We do this aiming to decrease the complication rates, the pain, the need for giving opioid pain medicines, and decrease the the epidemic of opioid addiction that we're living. So that's why we decided to look for better ways to do surgery effectively, but decreasing the complications. How we have accomplished this? By developing smaller instruments, smaller cameras that allow us to access the cavities where the surgeon will be working. Either could be the chest, the abdomen, joints. In my specialty, the area where I work is the abdomen, and I have at my disposal, in the hospital where I work, the most advanced laparoscopic instruments that allow me to do my procedures in a minimally invasive way, but also the most advanced tool available for surgeons, which is the Da Vinci robot. And as you said, has resulted in better acceptance of my patients to go to accept surgery, and also a faster recovery, faster return to work, and in general better satisfaction.
Just very quickly, I want to touch on this because we did discuss the Da Vinci technique or the instrument and using the techniques. Recently, we were talking about some neurologic techniques, surgical issues. And the interesting thing about it, and it came to us with questions from these nice people who watch us, and they always want to know, well, is the robot really doing the surgery? Or and I know the answer, but I mean, I want you to tell the folks, because it's your capability with your hands, your mind, and your heart.
Yes, sir.
That enables you to use the instrument called a Da Vinci. So talk about it.
Correct. Yes, it's a very common question when I see patients in my office and I offer them a robotic surgery. They ask me, well, is the robot going to do the surgery, or are you going to be controlling the robot? And I reassure them that the robot is only a tool, that I'm always controlling myself. The surgeon during a robotic procedure is always in the operating room, feet away from the table. So the robot does not have any automatic feature. It's just a tool that allows me to perform a more precise dissection, identify critical structures earlier, and basically I'm able to handle tissue more carefully than if I do it with my own hands. It's also a more stable platform and allows me to see the cavity in high definition in 3 dimensions. So it's a huge step from open surgery or laparoscopic surgery, but the robot does not perform any automatic function ever.
That's an important feature. Well, Heather Friedman, even though we know you have a very important job with HCA, you were a bariatric surgical patient, and we appreciate you coming forward to discuss it.
Absolutely.
And I'd like you to, it's your discussion. Go ahead.
Absolutely. I had bariatric surgery back in August of 2001 with another surgeon. I will tell you that it was life-changing for me. I had tried constantly to lose weight. I did have some health issues such as asthma and autoimmune concerns. At one point, I was basically told, because I had taken so much prednisone from the age of 5 to 19, that I would never really be able to lose the weight, no matter how hard I tried, by medical practitioners. And I, as a young individual, I was about 18, was trying to see what I could do to possibly lose this weight, and had learned about, the gastric bypass. Did a lot of research, dug in, and, found that this would be the best option. So I said, let me give myself a year, see if I could lose the weight myself. Tried, was not successful again, and proceeded to have gastric bypass. It was the best thing I could do for my life. I used to weigh 341 pounds. I was 19 when I had the surgery, so I know it's not a common age range, but I decided that for my health, that this was the best decision, and my parents were very supportive of that. So proceeded to do the procedure. It was laparoscopically. I was only in the hospital for 4 days, and minimal, if anything, complaints or challenges with the surgery. It was very successful. I had lost over 160 pounds at that point. My asthma issues, no more. They were pretty much resolved. And I had my life back. I was able to move again, going from the mornings, not being able to move very much, to being very active, running around. I've had 2 beautiful, healthy boys after the procedure, who are 11 and 8 now. And I really don't know where I would be today if I had not had this procedure done.
I'm going to refer this question to Dr. Maciel, but I'm going to get back to you because I know that people just can't come to you and say, "Oh, I want to sculpt myself, I want to lose weight, et cetera, et cetera." But there are certain criteria, obviously, within the I guess you could say the accrediting and responsible nature of bariatric surgical procedures. So why don't we talk about that? For example, talk about BMI and things of that nature.
Yes, of course. BMI is a measurement that can be calculated from the height and weight of each person, each patient, and it will give you a number. If your BMI is between 35 and 40, and you have a weight-associated comorbidity, then you would qualify for bariatric surgery.
I don't want to interrupt you, but let's tell the people what BMI is.
BMI is body mass index. And then when your body mass index is above 40, you are an automatic candidate for bariatric surgery. Now, obviously, you have to have other requisites met before you can consider bariatric surgery. For example, you have to have tried other non-invasive and medically supervised methods of losing weight before becoming a candidate for bariatric surgery. And maybe we can ask Heather to tell us what she tried before she decided to go for bariatric surgery and how your experience was with that.
Heather, it's all yours.
All right. Pretty much the year before surgery, what I tried to do was do, decreased consumption, reducing my caloric intake, trying to do additional exercises, low impact as much as I could, and really trying not to eat like high complex, high carbohydrate food.
Mm-hmm.
So that was a challenge, though. That was very difficult. I could consume, no lie, as embarrassing as it is, like a pizza easily.
Mm-hmm.
And that was definitely some of the struggles that I saw as a young individual.
Could I ask both of you, either one of you, I would assume, at least this is what I've been told,
Mm-hmm.
that before you will proceed and do this procedure, there is some communication, and I don't want to say intervention, but basically it is, either a psychological communication,
Mm-hmm.
Nutritional communication, et cetera, because just doing the procedure is not magic. There's a lot of time, and I'm going to let you tell the folks,
Mm-hmm.
because from the time that you get the procedure to the time that you actually are a year or two out, you're going to need not necessarily a crutch, but you're going to need something to hold on to, which is not normal to your natural life.
Very
Is
true.
that correct?
That is 100% true. Actually, Dr. Maciel and I were talking about that the other day, where this is just a tool. This is a tool for you to use. And I did go through some psych evaluation to ensure that, I was in the right frame of mind and preparing for the surgery preoperatively, and understanding that I had to find different coping mechanisms, because my coping mechanism was food. And I would turn to food, whether it be stress-related or boredom, any of that. And it was very important as the patient to understand that this was no longer going to be my coping mechanism. And I had to understand how to deal with the stress. If I got upset, I couldn't turn to candy bars anymore, or things like that. So it is very important, I find, for the patient to understand that as they walk into this, that they have to learn how to better handle stress, how to, find different coping mechanisms that are beneficial and healthy to them.
Mm-hmm.
Dr. Maciel?
Yes, I would like to add and confirm that bariatric surgery is only a tool. She's right. It's a very powerful tool, though. However, if you go and commit to bariatric surgery, you're also committing to lifelong lifestyle changes, and you need to understand that as well. And that's why we require a psychological evaluation, nutritional evaluation, to offer you the support that you will need in case bariatric surgery is selected. But for example, I would like to hear a little more from Heather. See, how much weight were you able to lose? Did you gain it again? What was the time frame? How did you struggle with weight from your teenage years to your early adulthood? What was happening? What you tried, and how did you feel after you went and consulted with your medical practitioners?
I have come from a naturally obese family. My father was obese. My mother was overweight. Genetics were not in my favor. One of the challenges in life. And again, just having been active for a little bit, but then having an autoimmune challenge, which kind of was not allowing me to exercise as much. So running the track, doing, things like that weren't fun for me, or I didn't want to do. So of course, in the nature of eating, a lot of rice and beans and different things like that, I quickly put on the weight. But I am from a rather large family, a lot of individuals, so a lot of parties and things like that. So we would always eat. And that kind of became that social gathering of eating. And going through that process was, as I researched and found out about bariatric surgery, I understood that I had to change my lifestyle, and that this would help me make those changes, understanding what I could eat. So preoperatively, I started to prepare, okay, what kind of diet should I be looking at? That's some of the things that the surgeons and nutritionists help us understand is, here's the right food to eat. This is how you should be eating, quantity, what will assist in your weight loss. I probably had tried everything. I mean, even from the days of phentermine, to multiple Weight Watchers, different programs, weight loss programs that I had really tried. And even my parents would push and be like, okay, you have to lose the weight. I mean, when you are 19 years old and at that much weight, it was the decision to proceed forward, which was very beneficial. I lost altogether over 161 pounds.
That's after the procedure?
That was right after the procedure. I did keep that off for about a good 3 or 4 years. So in 2006, I was married and was still fairly well. And then in 2007, I had my first child. Of course, gained some weight. In between that, I did have some reconstructive surgery, though.
Okay.
They did take 6 pounds of skin that was removed. So that was done. And then I did have my second child in about 2010 and realized, okay, I got to get back on the bandwagon, because I think in total I gained back about somewhere between 20 to 30 pounds. And I was like, okay, I've got to go back to what I've learned. Went back to my roots of understanding what's the best, not eating overly processed foods. Some of the lessons I learned, in the bariatric program was, sticking to the outside of the grocery stores, not going to the middle aisles that have all these boxed foods, and trying to eat natural, healthy, food. So I did that, and I proceeded to go back down. So since the surgery, I would say all in all, I'm about 15 pounds away from going back to that original goal weight.
Excellent.
After surgery.
You are an example for the people out there. One of the things, and I'll just throw it out to both of you, but one of the things that we talk about, by the way, at Nova Southeastern University's College of Osteopathic Medicine, we're just accredited to do a master's in nutrition along with the medical degree. And the reason is because there's not only, we'll talk about obesity right now, but there are multiple elements of health, I should say, evolution that occurs, cardiac disease, diabetes, all kinds of things that happen with obese individuals. I guess it must be a battle. I mean, you're the one who's the warrior. You're the one who presents individuals like Heather back to the public and doing your surgical techniques. But the intercession by the nutritionist, to me, is very, very vital.
It's paramount. It's paramount. It's the core of losing weight, being knowledgeable about nutrition and sticking to the plan. But that's why we have medical teams built to help the patients, sticking to the plan and help them understand what they can eat and different diets that work, definitely.
Yeah, because, we mentioned before, but, obesity is endemic now in people under the age of 20. I mean, you fit the category at that point in time. Not to, you know, I mean, you were kind enough to come onto the show and be an advocate for the people that are out there that need your support. But, you know, I mean, it is really sad to see what has happened. I mean, like I said, it's not only the weight, it's the imposition upon the body structure, the cardiac disease, the diabetes, the amputations. I mean, multiple things that happen, you know, from the teen years to the early 40s, which is really something that could be avoided. Is that?
Well, yeah, that's true? Absolutely true. Obesity affects every single organ in the body, and it's been proven that by being obese compared to other normal weight peers, obese patients tend to live 7 to 14 years shorter than those healthy weight individuals. And as you mentioned, obesity can affect cardiac disease, reflux. It's been associated more recently with different types of cancer, breast cancer, colon cancer, prostate cancer. The more we learn about obesity, the more correlations we see with other diseases that we are trying unsuccessfully to treat. But then with bariatric surgery and losing weight, we have reversed or completely resolved certain diseases. One great example is diabetes. If you treat the patient on time, meaning very soon after the diagnosis of diabetes can be completely resolved or very improved. The same applies for hypertension, sleep apnea, reflux, etc. And looking in a longer, bigger paradigm, cancer can be also prevented if we intervene on time.
Well, believe it or not, we're down to the last 3 minutes of the show. I'd like it to run another hour or a half hour because there's so much. But Dr. Maciel, I appreciate, I know of your competence. We don't bring people onto the show that are not, shall we say, known for their competence.
Thank you.
And I think that having you in that, and right now at Plantation General, and soon you'll be moving right here,
yes, sir,
which will be next door on the Nova Southeastern University campus. And I want to thank you for not only your capability as a physician, but really, I could hear it. You're an advocate for your patients.
I am, and I'm passionate about this. I really have dedicated my life to helping people, and I truly believe that bariatric surgery is the most powerful intervention that a physician can do to help and improve the health in all systems that we have discussed.
Well, as I always say, the advocates are the blessings that we get from God. So,
thank you very much.
Heather, I appreciate the fact that you were willing to come on the show and discuss personal issues, which that's what they were. But you're an expert in the effect of bariatric intervention as well as psychological and nutritional intervention. So we thank you very much for being here. And of course, I do know you're the HCA area practice manager, so we're going to see a lot of you.
Yes.
But I thank you really for coming forward, all right?
Thank you for having me.
Take good care of your kids.
I
all
will.
Right? There you go. Well, folks, I hope that we gave you some insight into some of your questions. And remember, if you have any questions about bariatric surgical techniques or the nutrition issues or whatever, all you have to do is contact, I'm sure if you contact Heather Friedman, we can put up your telephone number because you're going to be able to tell people where they can go visit people. But Dr. Victor Maciel is really the key. And we want to thank you, Dr. Maciel, for being here. And good luck, and just keep on advocating as you have presented to the people. Folks, I hope, again, that we answered some of your questions and maybe we stimulated some thought processes relative to obesity. Thank you once again for showing up. Remember, if you have any questions or comments, there's a email address here and a telephone number. And remember, this show is called Dateline Health. I want you to take good care of yourself. And the only way you take care of yourself is to refer your problems to physicians and people that have the knowledge. This program comes to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see ya.